Hi guys, Dr. Nay here. Woo! This is getting tough. And I've had a bunch of revelations this week. So my expertise is actually in something called developmental trauma or complex PTSD. And I'm very excited that the World Health Organization has finally made it a diagnosis in 2019. And it's actually going to be a diagnosis that I think we can use in our practice in 2022. And complex PTSD, I believe everybody has it because it's something called relational trauma or developmental trauma. And I don't know, but do you have perfect parents? I'm certainly not a perfect parent. And so every single person who comes to my office, whether they have an addiction, a compulsive behavior such as sex or gambling, they have obsessive thoughts and rumination which cause anxiety and depression, or just any relational issues that they have with their spouse or their children, is all based upon their relational trauma from their childhood that they haven't healed. And so relational trauma is, or complex PTSD, what makes it so complex is that it's chronic. It happens actually between the developmental years of 0 to 6 and also again in adolescence. And it can range through a bunch of topics. If we put it on a scale of 0 to 10, let's think about it like this. Some people are emotionally neglected, feel emotionally abandoned, don't feel attuned to. I personally had role reversal where I was the parent to my mother. Some people, I would say that's like a 0 to 5. But if we go to 5 to 10, people have had sexual abuse, sadistic abuse, physical abuse, been orphans, been abandoned. And it's really my area of expertise because it affects every single person. So that's how I view my whole practice. And so the other day I was thinking, wow, this COVID-19 has all of the aspects of relational trauma. I mean, because let's just think about it. We, as a child, when we experience trauma, and trauma is a wound, it's something that overwhelms the mind and body's capacity to deal with it. That's what it means. We don't have the coping mechanisms to deal with it. And so right now, we have the first thing of relational trauma. It's chronic. We don't know when this is going to end or how it's going to end. We're also, just like children, we're vulnerable and we're helpless. I mean, even though we can do certain things, we don't have power right now, or we feel that we don't. And that's certainly what the child has. Also, relational trauma can happen through separation and losses. I mean, I don't know about you, but I think all of us are feeling losses, financial losses, we're feeling physical threat, we're in isolation. And our whole relationship to the world has totally changed. Also, I don't know, but I'm feeling a little physically and emotionally neglected by our government. Who's in charge? The governors, the president, us? So it has so many pieces of complex PTSD, which what I have experienced, everyone has. That's what I wrote my dissertation on, healing developmental trauma. And what I'm seeing getting activated right now is through this COVID-19 mass trauma, where we're feeling physical threat, financial threat, and isolation. I think that most of us, myself included, and my patients, it's activating all of their complex PTSD or relational trauma. That's why we see Domestic violence rising. Suicides rising. I just heard of a young girl that I knew that committed suicide today. I grew up across the street from her in Manhattan Beach. Substance abuse is rising. So many people are relapsing. We need more mental health services. I know that. I am doing my part as best as I can. But please, if you are feeling activated, know that it's normal. Call a hotline. Go to a domestic shelter. Find out a sliding scale place in your state. The thing about relational trauma, whether it's with the world or a person, is that just like a vaccination, the wounding happened in relationship. The healing has to happen through a relationship. We need other people to help us heal. Please don't feel shame, because that's what complex PTSD causes. That's what's at the root of complex PTSD or relational trauma. We shame or blame ourselves. Right now, we are not to blame for COVID-19. We are not. It's a virus. It's a pandemic. It happens. I am begging you, pay attention, go get help if you need it. Understand that this is happening to all of us on some level, because we're all relational. We're in relationship with the world. And if nothing else, wear a mask. We know it works. I'm thinking of all of you, and I'm offering this message of hope. We can survive this, but we have to take action on our behalf if we're not feeling right. And most of us aren't, and it's okay. Like Mr. Rogers says, just look for the helpers. Be well, dear ones, thinking of you.